California Pacific Medical Center, part of the Sutter Health Network, we recognize that no matter how far medicine and technology advance, real healing begins only when doctors and nurses make a genuine connection with the patient. We take our relationships very personally, and there are stories playing out here every single day that reinforce that belief. Dr. Jordan Horowitz is a gynecologist who's been with CPMC for more than 30 years. For much of his career, he also provided obstetric services. Two of his favorite patients are twin sisters Beth Weingart and Jenny Legale. Between them, they have 9 children, and Dr. Horowitz was there to help them deliver every single one.
So there are these twin sisters, Jenny and Beth, who are awesome, and they developed what I would call was the obstetrical Cold War. Over a period of years, one would have a baby, the other one would have a baby.
With Beth and I, one of the things that he loved to do is try to pit us one against the other and see who was more competitive than the other. Who would win any race, whether it was who gained the most weight when we were pregnant, or who had the biggest baby, or or who had the most babies.
So are we supposed to tell Dr. Horowitz what he created here? Look at the mess that he created here.
Yes, this is a mess.
Yeah, this is
We always thought we would have twins, but we didn't. I had my first 4, 1, 2, 3, 4. Jenny had 1, 2, and then 3. And so I go to Dr. Horowitz for sonogram, of course, by myself. It's just the 4th kid. And, you know, I told him, I said, for some reason we think these are going to be twins. And so he really did know that. It's weird. Yeah, and so he, you know, we put the sonogram up on the camera, and at first you could just see 1, and I remember thinking, oh wow, I was so surprised. And then all of a sudden, Dr. Horowitz turns just a little bit, and boom, pops the 2nd child.
She raised her hands like Rocky, triumphantly over her head, shouting, "I win!" and immediately called Beth to let her know that she was having 5 instead of 4.
As he keeps it all light and fun and easygoing, but really underneath he's listening to everything you say, and he's focused on what he needs to do. He gets the job done, he gets it done well, but he keeps it all light and fun.
Medicine is an interesting thing in that they talk about the practice of medicine. You never perfect it, but hopefully you learn and get better at it. The reason that I'm still excited to be a doctor is that I have fun at what I'm doing every day.
Dr. Oded Herbsman is known for building strong relationships, but even he couldn't have foreseen the impact he would have on what has become one of his most memorable patients. As a teenager, Gabriella Franks suffered from a difficult bowel obstruction, which required several surgeries and a 4-month stay at CPMC. Gabby, as her friends call her, was bedridden for much of that time, but fondly remembers how Dr. Herbsman would bring her small gifts, spend extra time with her parents to help calm their fears, and even organize visits to her room from other teenagers who were also hospitalized. Her experience at CPMC made a lasting impression, and the care she received from her nurses and Dr. Herbsman ultimately inspired her to choose nursing as a career, one she now practices at the very same hospital where she once was a patient.
She's a great nurse. She's compassionate, she's smart, she's sharp, she advocates for families, and it's the most amazing feeling that somebody who spent 4 months here under, you know, fairly unpleasant circumstances because of her illness, came back and wanted to work here and wanted to take care of children, and was so inspired by the nurses and doctors that took care of her that that's what she chose to do for the rest of her life. So we're delighted to have her here. We take care of patients as if they're our own family, our own children. And so you cry when it's sad, and you laugh when it's funny, and you enjoy their successes and their graduations and leaving the hospital. And you go to funeral when you have to, and you shed tears for a child that passed away. And the best doctors and nurses that I know do that. They feel everything. If you don't have the empathy, it's a very hard job to do.
I really feel like I have a different perspective because I understand, you know, their physical pain and just the emotional pain that the children and the families are going through. And I feel such a connection being here with the staff and the patients, and I can't imagine being anywhere else.
Most of healing is about the environment around you, and it has to be a wonderful, caring environment. And that's something we do very well in pediatrics and in women's and children's in general. We take wonderful, wonderful care of everything else, not just the body, but the mind and the heart, and taking care of the patient's emotional and psychological needs.
Dr. Terry Slagle is the clinical director of CPMC's Newborn Intensive Care Unit, more commonly called the NICU. Most of the babies her team treats are born weeks early and usually weigh less than 3 pounds. It's delicate, often difficult work, and she says one of the most challenging parts of the job is quickly developing a trusting relationship with families who are thrust into a stressful situation. One of her favorite examples of this is the Adam and Andrea St. Prix family, with whom she built particularly strong ties. Their son Savian had been in the NICU for about 4 weeks and was doing quite well, until one day he threw up, got milk into his lungs, and went into a rapid downward spiral.
But I used to always grab his finger and he'd give me a little squeeze, you know? And just throughout the process, I was like, okay, as long as I get my squeeze, I know he's okay. And that morning, I kept trying to grab his hand, and at one point when all the nurses and doctors started to come in, I was trying to get my squeeze and there was just nothing.
And in that short period of time, he was not doing well, but he very, very quickly turned critical. Things went into pandemonium, like you see in the scene of an ER show. And he basically stopped breathing.
I was called over to the bedside to evaluate him, and it was clear that he needed to have a tube put back on to help him breathe, put on a ventilator again.
They kind of, ushered us out, and Dr. Slagle went into action, and we were just outside waiting, and, just waiting, not knowing what would happen.
Horrible time.
Yeah, it was pretty traumatic.
As soon as they got Savian stable, the first thing Dr. Slagle did is made them come out and get us. And the nurses didn't want to come get us right away because they wanted an opportunity to clean up. And Dr. Slagle said, absolutely not. You go get his parents and you get them back in here now, because he needs to hear their voices and he needs to feel their hands.
There's no question at all that she saved his life. None.
We have really extraordinary outcomes in our nursery, and I think part of that is we have moms that are coming to us who take great care of themselves. And I also have an absolutely amazing team of doctors and nurses and respiratory therapists and nutritionists and everybody that's really pulling in the same direction, putting the care of the babies and their families at the center.
And making progress again.
Yeah. Nobody chooses the newborn ICU as part of their birth plan. So we have to form a relationship with the parents. And it's hard. When you go through life and death circumstances with these families, it's hard not to become a little attached to everyone.
Coming out of a situation like this, you are very acutely aware of the fragility of life, shall I say. That in a moment, things can change.
You appreciate life a whole lot more having gone through this experience, and you appreciate being able to have a child having gone through this experience.
They are caring, inspiring, and dedicated. And the extraordinary personal attention provided by our doctors, nurses, and staff is firmly rooted in our belief that to care for our patients, we must first truly care about them. That belief forms the foundation for the many extraordinary things happening every day at CPMC, where lives are touched, lives are changed, and lives are saved. To support the compassionate care delivered every day at CPMC, please visit the CPMC Foundation website at cpmcf.org and click on the Donate Now button for more information.